Do you have knee pain? Does it hurt when you go up and down the stairs? Maybe when you squat down, and for sure when you're running? If you have wobbly knees, if you're trying to figure out what happened and most importantly, what you can do to speed up the healing process, this video is for you. Hey, my name is Lucas. I'm a yoga teacher, a teacher trainer. Over the past couple of decades, I've had literally over 1,000 students come to class with knee problems, and 80% of the time, these are minor problems that if you get on top of it, if you take care of it, they can resolve within 2 to 8 weeks. Now, on the flip side, if you self-medicate, if you try to push through the pain, very often these very minor injuries can get re-injured, exacerbated, can turn to something chronic, and worst case scenario, you might even need surgery. In this video, we will chat about the anatomy of your knee. We'll talk about the things that can go wrong in the 80% of those cases where you have minor injuries. And lastly, we'll look at some corrective exercises and some best practices for healing. Quick disclaimer here. If you have had a high impact injury, if you were snowboarding, high explosive sports, if you've had a slip and a fall, if you have inflammation, internal bleeding, if you're having trouble walking across the room, please go see a doctor. This is for educational purposes only. Before we get into the anatomy of the knee, let's do some simple tests to try to isolate where exactly your knee pain is coming from. Whichever leg is having the pain, let's assume it's your right leg, I'd like you to stand on just one leg. You can steeple your hands, lift your other leg up off the ground, and now we're balancing on that injured knee. I'd like you to twist a little to the right, twist a little to the left, back to center, bend your knee a little bit. Now pause here. Are you able to isolate the pain? Meaning, is it on the inside? Is it on the outside? Is it on the front of your knee, maybe on the top of your knee? Do you feel it maybe here underneath your femur? Try to get really specific. Now, I know some of you say, Lucas, I can stand on one leg. I don't feel it then. It happens when I squat. Okay, let's try the squatting. Feet a little bit wider than your hips. Hinge at your hips, go down, 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 back up. Let's try it again, down, 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 back up. What about now? Are you able to make a little pen mark where that pain is? Let's try one more time, just in case you're not feeling it. This is a number 4 pose. Put your heel up on the opposite knee, and from here, start to squat down, down, down. Are you able to isolate where that knee pain is coming from? Again, if you can, make a little dot. It'll be useful for us later on. Okay, let's take a look at the anatomy of the knee. Your knee joint is the biggest joint in your body, and it's really a remarkable structure. It's a hinge joint, and what that means is it likes to flex and extend and not much else. It has a little bit of rotation, but not much, and it doesn't like rotation. In fact, many of the injuries happen when the knee over-rotates because that's not what it's designed to do. Again, it likes to close and open. It likes to flex and extend. Today, we will be talking about those 80% of injuries, those very, very common, very minor injuries that happen from everyday things, like running, like working out at the gym, like pushing a little bit too hard during a pickup game with your friends at the field. And we'll be talking specifically about tendons, muscle to bone, ligaments, bone to bone, and then finally the cartilage that separates your femur from your tibia, those cushioning surfaces between your bones. There are, of course, lots of other things that can go wrong with your knees. It could be related to your IT band, your bursa, osteoarthritis. We'll cover those in future videos. For today, we'll be chatting about the most common minor injuries that you can very often heal on your own. Let's take a look at, first, the tendons of the knee. In this knee model, the muscles have been stripped away, and what you're looking at here are the tendons, which are muscle to bone connective tissues, and on the top of your leg, you have 4 big muscles called your quads, and they turn into your quadriceps tendon. They connect your 4 quadriceps muscles to the bone that is your patella, your kneecap. Now down below here, your patella connects to your tibia with your patellar tendon, which is down below. Now these are separate tissues, but as you can see, they do affect each other directly. On either side of your knee, we have your collateral ligaments. On the inside, you have your medial collateral ligament. On the outside, you have your lateral collateral ligament. These are often abbreviated MCL or LCL. And these tissues, when you look at them, for an outsider, you look at those tendons, you look at those ligaments, and you think, those must be the main scaffolding, the main support for your knee. If your knee's going to be stable, it's probably those tissues. That's what you would look at. That logically makes sense. You would be wrong. The majority of the stability comes from the inside of your knee. If you zoom in close here, This is called your ACL, or your anterior cruciate ligament. Cruciate means cross, and your ACL is in front, it's anterior. Your posterior, your PCL, is in back. These ligaments, specifically your ACL, is responsible for 90% or more of the stability of the knee. And in fact, these other tissues that often get damaged, these are supporting tissues. Very, very important, but they're supporting primarily this big structure, this important structure in the middle called your ACL. We won't be talking about ACL injuries in this video because, again, that's a major injury. That doesn't happen when you go out for a run. That rarely happens with a gym workout, and that's probably not going to happen when you're out playing with the kids. When we have minor knee injuries, it's very often these supporting tissues, and one last tissue we haven't talked about yet, which is your meniscus or your menisci. In between your upper leg and your lower leg, we have these rings of cartilage that act as shock absorbers, and they're very often damaged. Meniscus injuries are very, very common, and when the injury or the tear is in the outer 1/3 of your meniscus, very often these can be healed on their own. I mention that because meniscus surgeries are one of the most common surgeries of all surgeries all the way in the world. It's a multi-billion-dollar industry, and there is a time and a place for meniscus surgeries, but like I mentioned before, 80% of the time these can be healed up on their own. A couple of things about all of these tissues, tendons, ligaments, cartilage, that's really important to understand. These are metabolically very slow tissues. That means they have very poor, if any, vascularization, not a lot of blood flow. This makes them really strong and resilient, like a leather belt around your waist, but it means that when they get damaged, if they get sprained, if they get a little tear, the healing process is slow, and you need to help your body do what it needs to do to heal up. The other thing you need to know about these tissues is they have very little, if any, nerves for pain. That means sometimes you can damage these tissues, and initially you might not feel anything at all. In fact, you might tear a meniscus, feel nothing until a day or two later when the inflammation starts to impinge upon a nerve next to it. This is important to remember during the healing process. Let's imagine that you start doing kickboxing for the first time, and you're kicking a heavy bag, and you miss the bag, and you overextend your knee, and suddenly something from behind is tweaked. Let's imagine that you're a casual runner, and you start training with some buddies for a marathon. So you double or triple your mileage in a week, and suddenly the inside of your knee is hurting during every run. Or maybe you're getting into weightlifting, and you're really excited about leg day, but when you squat past 90 degrees, sometimes it's not so much pain, but it's like your leg almost locks up. These are really, really common scenarios that happen, and very often the conditions, again, are related to these tissues, these connective tissues, tendons, ligaments, or cartilage. Here's what happens when you miss that heavy bag. Here's what happens when you put too much pressure on the medial side of your knee running or lifting weights. Get some damage. Maybe it's a sprain, maybe it's a meniscus tear, maybe it's a little bit of a tear in one of your tendons. Inflammation is what happens next, and this is sometimes what you can feel and what you can see and what leads to pain. And how we react is the number one thing you need to remember not to do. What we usually do is we take 600 milligrams of ibuprofen and we put ice, and maybe we compress or elevate the leg. And here's what happens. We cut off inflammation and we slow down the healing process. It's really important to remember that reduction of pain doesn't necessarily have anything to do with healing. And especially during the early days, it actually can hinder and slow healing altogether. When you get inflammation in that area, there's a very important thing that happens. Whether it's your meniscus, whether it's your ligaments, whether it's your tendons, the healing process happens through scarring. And this inflammation creates a process called neovascularization. New veins are created, new little capillaries, so new blood flow can come in. In fact, let's say you were doing a squat at the gym, you had some knee valgus, so your knee dipped in, you tweaked your medial collateral ligament and your medial meniscus, very common pairing. Now you've got some inflammation, now you've got some increased blood flow, you got a little bit of pain. That increased blood flow, inflammation, healing process, that might last for the next 2 to 4 months. It's really important you let your body do its work and heal up correctively. So now we understand that inflammation is good. Inflammation is part of the healing process. Now we've understood that your tissues need to heal up through a scarring process. Here's the next thing you need to understand. The scarring process has different phases. And as that scar tissue lays down, there are two things you need to know. Number one, doing nothing is a terrible idea because our scar tissue can heal up lumpy and crisscross with the fibers. We need to move so that our scar tissue heals up in a properly aligned fiber structure. Number two, that initial scar tissue is usually in a cartilage type 3 form. There's a bunch of different types of cartilage in your body for your skin and your connective tissues. Type 3 cartilage is not very strong, and that's the initial scarring. It turns into more of the type 2, the stronger cartilage structure, the original structure, through stress and use. So we need to very, very carefully use our joint so that the fibers line up. And number two, we need to stress the joint so that those tissues turn that type 3 cartilage into type 2 cartilage. That's a whole lot of ideas to wrap your head around. But basically what we need to do is, number one, try to live with inflammation and even discomfort if you can, so that we don't further the injury and that we don't turn off our body's healing mechanisms. Number two, you need to move to heal. Motion is lotion, movement is medicine, but we want to be very, very careful as we do it. Let's jump into some corrective exercises with a couple of caveats. I'm going to assume that your injury was relatively recent. I'm going to assume that you're dealing with one of these minor injuries that happen during common activities like a gym workout, running a little too hard, squatting a little bit too much at a gym. And lastly, we're going to take a very, very conservative approach using only isometric poses to load the tendons, the ligaments, and the cartilage of your knee. There's mixed research, some showing that isometric is best, some showing that isotonic movements are best. But here's what we know. When you move slowly, when you squat and hold, for example, there's less movement, more stability, less chance of accidentally retweaking your knees. So at least for the first couple of weeks, let's focus on very, very slow static poses, isometric poses, and we'll err on the side of caution. Just remember, you'll need to scale up, progressively load, and move on to more advanced exercises in the very near future. Let's get into the poses. The first pose we'll do is a one-legged wall sit. Just as a reminder, the PDF with all of these poses is down in the description below. For this pose, we need a block or something to put your foot on. We need a wall. I have this strange mirrored wall, but you can use any wall in your house. And I'll position my back to the wall. The most important thing is that your ankles are directly underneath your knee. That'll create more knee stability. Now, depending on your comfort level, you might be way up here. Maybe, depending on your comfort level, you might be all the way down to a 90-degree bend in your knees. The deeper you go, the more challenging it is. I'll put one foot up on the block, my other foot flat on the floor, both my feet in the same line. I'll squat down to the position where I feel comfortable-ish, and I'll start my timer. We'll do a 1 minute, one leg wall sit on either side. These are isometric holds, meaning we're squatting and not moving. They're designed to progressively load our tendons, our ligaments, and even a little bit the cartilage of the knee. If you feel any sharp shooting pain in that dot you put on your knee, please back off. You would back off by lifting up higher and not squatting so deeply. You would also back off by shortening the length of your hold. While you're doing 1 minute holds, if that's too much, you find a place that works for you. Remember, your pain needs to either stay the same or reduce. If your pain gets worse doing any of these poses, that's a bad sign. It needs to get better, not get worse to get better. You can gently rest your head along the wall. You can place your hands on your knees and breathe slowly in and out through your nose. Good. To release from the pose, I'll push away from the wall. I'll quickly switch my block to my left leg, start my timer for the other side. And again, find the depth that works right for you. Please try to match both sides so you're at an equal depth on either side. You've probably done a wall sit before in a physical fitness class or a personal training session. When we do the one-legged wall sit, it helps us to unilaterally load our knees a little bit differently. And this can be really helpful for isolating the problematic knee. We don't want to, however, just work the problematic knee. We want to equally distribute between either side. Your heels are heavy. Your back is pressed into the wall. You can rest your head into the wall, and I'll breathe in and out through my nose. And slowly push away from the wall and shake it out. By now your quads are probably a little bit on fire. I like to use my fists and punch it out and punch it out. The next pose we'll do also includes the wall, but we probably won't need a block. This next pose is called a Sissy Squat, and the name comes from Sisyphus, the Greek god. And the way a Sissy Squat normally works is without a wall, you would squat down like this. We'll use a wall so that we have greater support. For the first version, our feet will be together, our knees will be together, and I'll squat into the wall for a full minute. Let me show you how it works. We're again loading our knee in an isometric fashion. I'll be about 5 inches away from the wall, maybe 6 inches depending on the length of your legs. My feet are together, my knees are together, and I'll squat my knees into the wall. I'll steeple my hands, that's where you put your fingertips together. And I'll just look straight ahead at the wall with a neutral spine, which means my neck is long, my spine is long, but the balls of my feet are heavy, unlike that previous pose where our heels were heavy. And I allow my knees to get fully supported by squishing together and by pressing into the wall. Breathe in and out slowly through your nose. We'll do a 1 minute hold here. Good. Press away from the wall. Release your legs. Again, you can punch out your quads. They're probably feeling a little bit on fire. We'll do one more variation of this Sisyphus squat, the Sissy Squat. This time we'll do it with a block between our thighs, simply to keep our legs at the same distance. Rather than putting it between your knees or between your shins, put it just above your knees and we can squeeze in close. Now for some of you, it might feel better like me to do the short side of the block. Depends on how big your hips are. So you could do very narrow, mildly narrow, or you could do really, really wide. Any of these options can be helpful. Let's get into this variation, and we'll do another minute in this pose. My toes are about 6 inches from the wall, 5, 6 inches from the wall. Outer edges of my feet are parallel. I'll squat my knees into the wall, squeeze the block, and steeple my hands. One of the biggest challenges when people injure their knees is they want to get right back to doing the same thing that injured their knees in the first place. Whether that's running, squatting heavy, whether that's that kickboxing fitness class, you really need to take one step back in order to take 2 steps forward and recognize that your body's healing process is pretty well documented and is pretty genius if you can just give it time to do its thing. Let's inhale and exhale gently through our nose. Good. Press the wall away, release the block, and again, probably you need to punch out your legs here. Our final pose is an isometric step down. We're basically approximating what it would feel like to go down a set of stairs, except we'll hold it isometrically. I've got 2 blocks, but if you just have 1 block, instead of using a block on the floor, actually go to a staircase. Let me show you what it looks like, and then we'll start the timer. I'll have 1 foot on a block, or maybe in your case, a staircase. I'll have the other block between my thighs, just above my knees. I'll steeple my hands like we did before for balance, and I'll step down with my toes on the floor, and we'll hold here. Let me get my timer, you get ready, and we'll hold for a minute here with my hands steepled, my neck neutral, my standing leg here is bent, my other leg is straight, my toes on the floor, and I'm loading the heel on my bent leg. Whenever we're healing, remember what we're attempting to do. We're not trying to fix the injury, we're trying to heal. And this healing process has to do with that neovascularization. It has to do with helping those new fibers lay down in an organized fashion. And lastly, we want to help that type 3 collagen turn into type 2. And that happens through use, through load, but we have to be extra careful. Movement is medicine, but we need to give the right dose. And when we're first starting, it's less than you would think. Err on the side of caution and move slowly. In and out through your nose. Let's hold here. Good, release your block, release your legs. Might need to punch out your calf or your quad or both, and we'll switch sides and finish up our exercises here. I've got one foot on my block or on my staircase. My other leg comes out in front with the toes on the ground. I'll drive the weight into my heel, steeple my hands, and attempt to keep my neck and my spine neutral as I load that knee ever so gently here in an isometric step down, breathing through your nose. Good, release the block, punch out your calf, punch out your quad, and we are done. That's about a 6-minute routine with rest and break. It might take you a total of 8 or 10 minutes. This is a gentle routine. You could potentially do this every day or at least every other day. Within a couple of weeks, you'll need to scale up the intensity. Within a couple of weeks, you'll probably need to add some isotonic, some more dynamic movements, but please start slowly. If you found this video helpful, please subscribe for more science-based yoga videos. You can find my upcoming challenge, class, and training schedule at YOGABODY.com. Lastly, please grab the PDF down below for these poses so you have for reference, and I hope to see you in the next video.